Good morning, everyone. My name is Christian Morales, and for my anatomy signature assignment project, I chose the topic cystic fibrosis. To begin, you may ask yourself, what is cystic fibrosis? Cystic fibrosis, or CF for short, is a progressive genetic disorder that mainly affects the lungs and digestive system. There are 5 main classes of CF mutations, including protein production, protein processing, gating, conduction, and insufficient protein, with the most common being a protein processing mutation. It's able to develop anywhere in the body, but it mainly occurs in the lungs and digestive tract within white newborn babies, with a 1 in 2500 to 3500 chance. Taking a look at slide 3, we'll take a look at the genetic, environmental, and behavioral risk factors associated with the causes of cystic fibrosis. To begin, certain genetic mutations can contribute to the development of cystic fibrosis. Mutations in the CFTR gene, which provides instructions for making a protein called cystic fibrosis transmembrane conductance regulator, can cause CF. When the CFTR protein is functionally disrupted, chloride transport in and out of the cells is impacted, causing mucus secretions to become abnormally thick and sticky, making it harder to breathe. Additionally, CF is inherited in an autosomal recessive pattern, meaning a child has to inherit an abnormal gene from both parents to develop the condition. If a child inherits only one copy, they will be a carrier but usually not affected. Next, environmental risk factors such as being exposed to secondhand smoke, allergens, infectious agents, and bad indoor or outdoor air quality all affect cystic fibrosis lung health. Next, injury or lifestyle choices like smoking, diet, or exercise have no correlation to the development of cystic fibrosis whatsoever. And lastly, there is an AI-powered app called Breathe RM being tested that will hopefully allow for cystic fibrosis patients to be monitored remotely, removing the need for regular wellness checks in clinics or hospitals, and predicting when patients are likely to get a major infection. Next, we'll be taking a look at the demographics and statistics of cystic fibrosis in the US versus the EU and see who is most likely to develop cystic fibrosis. Cystic fibrosis can develop in people of all ages and races, but most cases of CF are commonly diagnosed in white children by the age of 2. Next, incidence rates for CF are about 1,000 new cases per year in the US alone, with more than 50% of new cases being male. Prevalence of CF occurring in Caucasians is 1 in every 3,200 newborns and 1 in every 15,000 in African Americans in the US. And next, incidence rates for CF in other parts of the world, like Europe for example, are about a 1 in 10,000 chance throughout the 27 European countries combined. And then, prevalence of cystic fibrosis occurring in Europe is a 1 in 2,000 to 3,000 chance in newborn babies. Moving on to slide 5, we'll be taking a look at the anatomy of cystic fibrosis and look at the primary organ systems, organs, and tissues affected by this disease. Cystic fibrosis affects a wide variety of major organ systems, but the main ones include the respiratory system and digestive system. Within the respiratory system, cystic fibrosis mainly affects the lungs and airways by building up a thick and sticky mucus on the respiratory epithelium. Bronchioles and alveoli by goblet cells secreting excess mucus in the airway. This in turn causes chronic inflammation and infections, leading to badly damaged lungs over time. Next, in the digestive system, the pancreas and gastrointestinal organs are affected. A thick mucus builds up in the pancreatic ducts, obstructing the secretion and neutralization of gastric acids and digestive enzymes. This in turn causes the gastrointestinal tract to get frequently obstructed due to the transport of mucus, causing greasy or bulky stool, nausea, or a swollen abdomen. Moving on to the physiology and symptoms of cystic fibrosis, we see that cystic fibrosis disrupts the body's normal physiological functioning of multiple organ systems, but it primarily affects the respiratory and digestive systems. Mutations in the CFTR genes result in absent or non-functional CFTR proteins, which normally regulate chloride ion and water transportation across cell membranes. Without these CFTR proteins, functioning secretory cells, such as the goblet cells, absorb an abnormal amount of sodium and water, altering their hydration and pH of mucus secretions, making them thick and sticky compared to normal mucus. This accumulation of thick and sticky mucus plugs ducts and tubes connecting glands and organ systems, disrupting their normal functioning. In the lungs, the airways and alveoli become clogged or inflamed, making breathing difficult and enabling repeat bacterial infections and inflammation. Common signs and symptoms of the airway becoming clogged with this mucus include wheezing, recurring lung infections like pneumonia or bronchitis, stuffy nose, and chronic coughing. Next, in the pancreas, the pancreatic duct become clogged, preventing secretion of digestive enzymes and bicarbonates necessary for breaking down food. This leads to symptoms such as intestinal blockages by thickened feces, vitamin deficiencies, abdomen swelling, or even chronic liver disease. Next, if symptoms of CF aren't properly managed, the long-term effects may be scarring and chronic infection in the respiratory and gastrointestinal system, and it could eventually lead to the reduction of a patient's life expectancy if unattended. Overall, typical life expectancy of a patient with CF is 50 years old, with more rare cases reaching to 80, and there is no survival rate from the disease, since it is genetic and can't be cured. Lastly, I'll be going over diagnosis, treatment, and current AI models available to help with diagnosis of cystic fibrosis. Cystic fibrosis can be diagnosed through a variety of evaluations and diagnostic tests, such as carrier testing, newborn screening, sweat testing, or a checkup for CFTR-related metabolic syndrome in early life. Current treatments available to help fight off CF are complex. It usually includes a long list of medications such as Trikafta, Symdeko, or Orkambi, which are all combinations of up to 3 medications each that target genes and help prevent and control symptoms like infections in the lungs or gastrointestinal system, intestinal blockages, and removing mucus from the lungs. The side effects and risks will vary based on each treatment type, but typically, people will report kidney and stomach problems, possible bone thinning, or increased blood sugar and blood pressure, etc. Risk may include organ damage or organ failure, infection, or long-term complications too. Next, cystic fibrosis can't be cured as it is a genetic disorder and can only be eased by medications to improve the patient's quality of life. And lastly, hospitals are using an AI-powered app named Breathe RM to not only remotely monitor and predict infections, as I mentioned earlier, but it'll also help doctors diagnose and create treatment plans for their patients.